welcome back. If you're new to my channel, go watch some other videos, but I'm a medical mom, a mom of two, handling a lot of different, there's a lot of different things going on in my household. But this is an educational series I'm doing, and this is something I've wanted to do for a while, and I kind of went back and forth. But I remember when we found out my daughter would need a trach and having to do all the training of what came along with it, and trach care being so intimidating. And so I want to do this for my fellow parents and honestly like nurses who are learning, because you learn on a doll. And when you realize what it's like to do it on an actual human being, it's very different. Okay, so you guys, just so you can see before, we are going to change out this dressing and the ties. We are not doing a trach change where we take out the whole trach. We are just changing the dressing and the ties. It's an open area. It's an open wound pretty much. So the stoma is been open and there's an incision there that's been open for her airway. But at the end of the day, it can get infected. There's so many things. So we need to make sure that we're clean and having good hygiene around her stoma. A successful trach care session starts with a setup and being organized. So we get all of our supplies through insurance, and we keep it in a shoe organization kit that hangs behind the door, and we have it all so we can see. We have our alcohol pad so we can wipe down the tray. We need gauze, we need Q-tips, we need dressing. This is going to be your standard setup and needs for every trach care session that we have. And we did trach care every other day. Some others do it differently. When we got home from the hospital, we did it every single day, but these were always our essentials for trach care. So we use this like TV dinner tray. Sometimes we do it on the floor and we have a different setup. But what you didn't see is I washed my hands, I sanitized them, and then I also wiped down the tray with an alcohol pad. And now I'm going to open up this gauze. Okay, so we laid out so I can see everything while I'm going. I start with 3 gauze, and we're going to have it be wet, dry, and powder. And so I open up like this, so I don't want it to really hit the tray. This is already clean area, but for me, it's really good to visually see what we're going to do. And I have it in an order that it's easy for me to grab and keep working my way through. So these Q-tips can be used for other things, but these are mainly our Q-tips for trach care. We also use them for G-tube cleaning and G-tube cream apply. What you'll see too is that they're like your standard Q-tips that you would clean your ears with, but they're a little bit longer, so there's a longer handle so we can really get around her stoma. Today, you won't see her exact stoma. You will see something. So disclaimer, if this might make you uncomfortable, a stoma is the opening of her trach, but I don't want to show too much, but just enough for you to really understand. So what I just used was a saline to wet the top Q-tips. That is what we're going to use to clean. The next row is what we're going to use to dry. And now I'm using nightstand powder to put on the gauze so we protect her skin, that barrier, because that is a lot of rubbing and tearing on her actual skin, and we want to have a couple different barriers to protect. I cut the ties so it's easier for me to insert through the actual trach opening that you'll see. And because this pediatric trach tie is set for a longer neck, I can look at it and eye it and know the size she needs. But what we also do is use a sample for our nurses and for others who might be doing trach care. It's really key so you have the right size. You want to make sure you know the right measurement, because you don't want to have to cut or put it on and it's too small. It can't fit around the neck. I like to give myself a little bit of slack so it's not going to have any opening and expose her skin. It needs to cover her whole entire neck. Because she's got a small neck and these ties can be kind of thick and kind of cut into her skin, this blue part, I make it a little bit skinnier so it can sit right in the middle of the trach tie area right there and not rub on either side of her neck. If it's too thick, it seems to dig a little bit into it. Some people do it differently. I like to put the powder on the ties as well. Again, this is how I do things, how we do it at home. Sometimes in the hospital, you're taught a different way. And I just advise you when you get home to kind of find the way that works for you, because you won't have the hospital bed. You won't have the backup. So there's a lot of things you're just not going to have in this setting at home that you have to adjust and adapt. And we've been doing this for years, and we just found a really good setup for us. Again, some people use gloves for this portion. I use gloves when we get into actually doing trach care. So as you see, we have wet, we have a dry, we have powder, and then we also have this gauze we added on later is for the back of her neck. I'm cleaning out our station. We've done this on the floor on the changing pad. We just started doing it on the dresser, and it feels like it works a lot better for us. We use this roll, just a pink towel roll, to place under her shoulders so the neck area is open and you have a bit of an arch. And then we're going to have this to wrap around her body. Some people are squirmy, some people are not. Again, I'm going to wash my hands again, dry them, use some hand sanitizer before I glove up. So I'm swaddling her. She is pretty good during trach care, but sometimes her hands move around and you just want to make sure it's really protective. As you see, she's already kind of moving. One of Rome or myself will do this with a nurse. And so today it's me and my husband doing it together. We are gloving up. We have the trach right there. We're going to attach her suction catheter and it's going to stay attached the whole time. So Rome's job is to hold. He is going to hold and he is going to turn the suction machine on. We are talking throughout this whole process. And we have found a great way for where his hands should be so I can move around. As you see, her legs are already moving. So I've taken the ties off and I'm using those wet Q-tips to clean around the stoma, around the opening. And I'm using the gauze to clean around her neck. So I'm going to do that on each side. So I'm going to use the right side and clean, and then I'll do the left side and clean. Some people do it differently. I'm doing wet, then dry, and then I'll go on the other side. So I have just cleaned that area and now I'm drying the area. And now I will start on the opposite side and use the wet Q-tips to clean the left part of her stoma. And then I'll use the gauze to clean the left part of her neck. So again, wet, then dry, and then I do powder at the end. Some people like to do wet for everything, dry for everything. So it just depends on like your flow and how you like it. Again, now I am drying and taking the dry Q-tip to get around that stoma. And again, the stoma is the opening and she needs this for her obstructed airway. So it's really crucial that you communicate with your partner. So I'm telling him, I'll say crib side, I'll say wall side. I'll let him know she needs a suction. So he just turned the suction machine on and now I'm giving her a suction. Sometimes she needs frequent suctioning and sometimes she doesn't need that many at all. So it just depends on the day she's having, but I'm kind of recentering her neck a couple different times. So she's looking straight up. As you can see, a little bit closer angle of what it looks like when the ties are off in her neck. So it's so key for that holding position that I can get in there and that the fingers are placed. Sometimes, as you see, he is moving his hands back and forth, sometimes using 2 fingers to hold each side, and sometimes he uses 1 finger and lifts the other one up so I can clean it. So right now, Rome said I didn't have enough powder on there, so I'm adding more powder directly to her skin, and then we're going to put the dressing. So the dressing is the protective layer, so what you just saw, her trach, it's not digging into her skin. So the little flaps on each side, I'm pulling them up so I can get the dressing around so that area doesn't dig. She's coughing right now. We like to stop for a second and give her a chance to breathe and a break. It's not uncomfortable for her. Sometimes it tickles because we're getting in that neck area and we just give her breaks. We talk her through it. I'll tell her she's doing a great job. We'll remain calm throughout the whole process. We smile and we want her to know that it's serious, that we can't have her moving around. But for her, it's just an everyday thing that we do and it's part of her routine. And so she's come accustomed to it. So now that the dressing is on, I'm going to take each side of the trach tie and loop it through the tubing for the trach, the opening, the little flangey part. And you want to make sure that it's nice and tight and it's not loose. So I take my fingers, go through each one to make sure that it doesn't lift up because you want them to be really secure. Another suction. We always do one good suction before we sit her up. We take the take the catheter off, and now I'm going to tighten the ties, okay? So we're going to secure them around her neck. My husband is having both fingers around her trach area. He's using one hand to support her hair just in case this gets in the way. And we're done. So it usually takes us about 15 minutes to do trach care. We celebrate afterwards, and she carries along her day. The cleanup, we make sure we wipe everything down, we clean up, and we move on. Drop any questions you have below on trach care, how it works. Again, we do this every other day, sometimes every day, depending on how she's doing. And it is a big part of her routine. It's really important to make sure that area is clean so there's no infections, and it's our day. You know, we've become more confident as we've gone. Drop a comment below and questions below, and I'll answer them in the next video. All right, here, look at this is the finished product. So you can't really tell the difference than before than after, but it's just a clean tie and a clean dressing, and it's time to go play.